Good afternoon to you today, the 24th of December. We are at the end of a trying and a challenging and a difficult year. And to end this year, we are unfortunately facing a very serious second wave of COVID, which is even overtaking in its severity the first wave that we went through earlier this year. Yesterday, we saw over 14,000 new cases in the country, the highest ever daily count of new cases. And with that came the somber toll of over 3,000 deaths over the past week. So what has triggered this new wave, which has come on us unexpectedly much sooner than we had predicted? I think it may have been triggered by that ill-advised, massive super-spreading event of the Rage festivals in KZN. And now it is largely being driven by the new variant of the virus, which I'll give a more detailed explanation in a separate video. Suffice it to say that this new variant is a lot more transmissible, that is, a lot more infectious, and it is fast becoming the dominant virus in the epidemic. What is also very significant about this new variant, and the new second wave itself, is that there are now a lot more younger people who are more seriously ill, many in hospital, and also a lot more younger folk with no apparent underlying illnesses to explain why they are so seriously affected by COVID. Unfortunately, some of them may well suffer long-term complications. So, what can we do about this new significant health threat? If we look at what has driven this major upsurge, it really is simply human behavior. Human behavior. People not being conscious of the seriousness of the epidemic, having parties and functions, letting go of common sense and socializing, often without masks and without physical distancing. In many cases, behavior fueled by alcohol. Yes, it really has been a tough year, and people are also getting tired of hearing the same messages over and over again. But the reality is that the virus has not gone away. We don't have a vaccine, and we won't have one for general use, at best, before the latter part of the next year. So let me emphasize, at the moment, these precautions that we keep emphasizing are all we have. We simply have to rely on each and every one of us being responsible for our own health and that of our families, and all of those around us in the community. This is fact, and this is the reality. If we forego these precautions, then indeed we will keep seeing the same serious situation that we are now facing with the current second wave. This is in our hands, and we can effectively control the epidemic. We just need to step back and think carefully of what we do and what we don't do. So please look after yourselves and look after others. This will not last forever. Eventually we will overcome and control the epidemic. But meanwhile, it is up to all of us and how we behave to keep the virus at bay.